Hey everybody. I actually got a question a few days ago from Aylin asking. I think that's how you say her name. Anyway, she had the question. She had a couple geriatric chest X-rays come in, and she asked, what we can do to help geriatric patients get a better picture, have a better experience. And I thought I would answer that. I'm trying a new audio thing here, and take this advantage to answer that question the best I can, and let other people who may have the same question in on it. So, anyway, geriatric patients, we do a fair amount of them. The thing we need to remember about geriatric patients is sometimes they can't hear real well. Sometimes they're weak and feeble. There's some demineralization going on in their bones, and they have softer, more radiolucent bones, which affects the techniques that we use on them. Uh, but the first thing I would do when I had a geriatric patient in for a chest X-ray or any other X-ray is I would take the time to educate them. Let them know what we are doing to them, the type of position they're going to be in, and the type of breathing instructions that will be expected from them. Number two, speak low and as close to the patient as you can. Uh, we don't want to be screaming at our patients. I've just found that versus screaming versus getting close to the patient and speaking directly to them, things usually go a little bit smoother, and they don't feel like they're being attacked. Just take special care in talking to them as close as you can get, so they can hear you okay. We just want to try and alleviate any anxiety or stress they may be having. I know when I've been around my grandparents who are feeble and were feeble, uh, they were really worried about having to stand up and do something for the fear of falling. We want to try and take that from them. So we're going to really treat our geriatric patients with kid gloves. We're always going to be there to support them, right? Um, don't refer to them as honey or dear or any of those terms of endearment. We want to be respectful to them. We want to refer to them as Mr., Miss, Mrs., whatever it may be, but treat them with the utmost respect. I was always taught to respect my elders, and this is no different. Um, they're maybe going through something medically. Obviously, that's the reason they're getting an X-ray, and we deserve to treat that patient the best we can, with the most respect that we can. Um, little things like providing time in between projections. Say we're doing a chest X-ray, we get the patient up there, they're holding on to the upright bucky, and it is okay to use the equipment as far as being able to hold on to. But let them give that bucky a big hug, so they feel safe when they've got their chest up against the bucky. Okay, take the picture. We can have them sit down for a second if they need to in between pictures. In fact, that's a good idea. Unless they're feeling strong and they want to push through, that's okay too. But just know that it is an option to take a little bit extra time. Let them sit down between projections. Um, let them know that we are there for them. We need to remain as close as we can to them. Uh, I know sometimes it's tough when we're the only one in there and we need to go expose the image. I think with geriatric patients, it's okay to have another person in there, somebody that can be on the ready if they notice that patient is about to fall or is feeling insecure or weak. Somebody can be there for them at all times. Just keep somebody close. Technical factors, I talked a little bit about this. Our technical factors are going to go down a little bit, not drastically, just for the fact that they have less bone. Uh, So when that X-ray energy goes through there, it's going to eat more easily and readily pass through elderly's bones. Okay, and it's going to make our pictures a little bit dark. So, uh, just bumping a couple steps down on the mass will help. Just realize that they're going through maybe some osteoporosis, osteopenia, osteoarthritis, uh, just the demineralization of bone content. So we need to keep that in mind, that we're going to need less technique to shoot X-rays on geriatric patients. I hope this was helpful. Uh, just take your time with them. Uh, Speak right at them as close as you can get without screaming. Um, Treat them with respect, Mr., Mrs. How was your day? Take the time to get to know them a little bit and make them feel comfortable around you. Uh, Let them hold on to things, so that they feel more secure. If you have to have somebody else in the room with you, that's okay. We just want them to feel safe in the X-ray space and get the images that we need. Let them rest in between images. Yeah, let's take the time with our geriatric patients and make them feel comfortable and welcome. It's just like having a kid in there. They're a little apprehensive, a little bit scared. It's just a little bit different on the geriatric end of things. They're not scared for the same reason. They're scared that they may fall, or they're scared that they may not be able to hear instructions. So let's just make sure we're speaking clearly and respectful, and turn down your techniques a little bit. And uh, I hope this was helpful. And I'm trying to figure something out, so I'll post this. And well, thanks for the question, Aylin. I appreciate it. You guys have a good day. Bye.